When patients are deciding between an implant and a bridge, there's not a right or wrong answer. I prefer implants in the best implant situation. Sometimes that's not always available. So that's my number one is to go to, hey, let's put an implant in there because that way we don't have to adjust the tubes to the left or to the right of the space. We can just put the implant in. Other cases, the tubes to the left or to the right, they do need treatment. They may need crowns or other treatment. And then a bridge is maybe more optimal. Implants usually take time, usually over 6 months. Bridge takes about 2 or 3 weeks and we're done. I definitely prefer implants over bridges. Replacing the tooth root, not just the visible tooth, is so important. The main thing it does is maintain bone integrity and the integrity of the jaw. So if I put an implant in there, even if I don't put a tooth on it, it helps maintain the jaw, help maintain the strength of the jaw, and decreases the deterioration of bone over time. So the implant itself is a mainstay in keeping the bone alive and well. Comparing an implant to a bridge, an implant you just put it in and you don't do anything with the adjacent teeth. With a bridge, what you can see is some deterioration of the tooth over time. Sometimes you can get cavity around the current tooth that you're bridging. You can get food caught. You can cause periodontal disease. Those things are not necessarily going to happen, but there are higher risks of those than having an implant. So that's something that we will always want to pay attention to. Just a little bit more maintenance, a little bit more issues with the bridge compared to the implant. There are definitely instances where a bridge makes sense. Most of those instances where there are severe damage. We've had basketball injuries. We work with Purdue Sports, and we've had severe basketball injuries where we could not put an implant in because they were damaged or broken so bad. In those situations, we can't put implants in. In situations, sometimes cosmetic, sometimes it's harder to get an implant to look really good. And compared to a bridge, I can make a bridge look really good, more cosmetic, more instantly. They don't have to wait. If you're without a tooth, the downtime without a tooth, especially a front tooth, is really hard, especially for a young person. Nobody wants to go without a tooth. With a bridge, you don't have to go without a tooth. I can make it look like you have a perfect smile within minutes, and you maybe got hit in the face or you're in a car accident. You leave with a brand new smile instantly. I had a kid just recently on a scooter. We here have at Purdue University, smashed all his front teeth. He left that day with a new smile and then got all his teeth done within 3 weeks. And he was back looking better than he did before. And so bridges are quick, easy, and cosmetically, I can make them look amazing. Advanced implant planning and placement definitely improves outcomes. We look at CT, 3D technology, so we can see exactly what's going on before we get there. We can plan out the surgery. We know exactly the length, the width. It's very crucial that we get the right width, get the right height. Um, so, for instance, we're going to put a 3 millimeter implant in 5 millimeters of bone. You have no leeway to make a mistake. If it's not perfect, it will fail. So we want you to use 3D technology to the best of our ability to get everything perfect, to get everything right. And so we use it on every patient. To make patients feel comfortable when they're getting an implant or bridge or whatever we're doing here at the practice, first of all, we just talk to them. We start forming a relationship. We ask them what their concerns are. We ask them if they're scared and why they're scared. We're asking them if they've had past experiences that are bad and how can we avoid those experiences. And then we just go through the steps and we take time and we ask them if they're okay, and they'll have a blanket and my assistant may be patting their shoulder, and then we're just talking. We're talking through the whole procedure, telling them what's going on if they don't mind that, telling them what's going on and helping them understand it, and also giving them the leeway to say, hey, I need a break. Hey, that hurts. It doesn't feel good. Please tell me. Everything we do is around the patient, patient centered, patient focused, trying to make patients feel better at every turn, every instant. Everything we're doing is patient focused. It's not like, hey, we're just going to do this. You're going to sit down. It's like, hey, are you okay? We're going to walk you through this procedure. We're going to take care of you at every turn. It's going to be great. And just focusing on how many times we've done it and letting them know that we can take care